Okay, let's talk about our patient today.
Our patient today is a dentist.
Young lady, a preeminent lecturer,
The dental hygienist.
from Bulgaria,
Buffalo, New York.
Atlanta, Oklahoma, Vancouver, Canada, Boston, Kansas City, San Francisco, Montreal, Munich, Germany, London, and Santa Maria, California. And we're going to place 14 Lumineers,
8 Lumineers.
10 Lumineers,
6 Lumineers.
10, 2, 8, 8, 10, 10, 8, 10, 8 Lumineers today on our patient.
And now we're not treating teeth anymore. We're treating smiles.
Isn't that beautiful? Let's look at the transformation from where we started and where we are. Our patient today is an example of that.
Our patient today is Kristen Jameson, and some years ago I placed serenade porcelain laminates on her. That's what we called them at that time. And she's interested in seeing if she can have her teeth be made whiter. And of course, since we never removed any tooth structure, we have the ability to remove them, put her back to where she was, and or give her new ones. In this case, she'd like to have new ones. But she tells me it was 1986 when we placed these. So first we'll just go through here and take a look at the gingival margins. It looks as though there's class 5 restorations on here, but that's just her natural enamel, and her teeth were shorter then, so she's had more eruption. Now what we could do for Kristen is just smooth them, blend them, and get rid of the stains. And so all 6 are in place, and there was no necessity to remove any tooth structure. Can you see that all right? And then let's take a look at the opposing dentition. Close. Go forward. All the way open. And you can see it hasn't affected or eroded any of the opposing teeth. So there's nothing to be lost and only to be gained with Lumineers. Now what I'm going to do before we take it off, I'll show how to remove the stain. I use a 30 fluted burr. Now what we're doing is there's a little stain right here. See this stain right around the edge where that feather edge margin is? Can you see that? We're going to use a ultrafine diamond and get that to blend. Now I'm just blending the emergence profile. And just taking out the stain and blending the teeth. And I'm using a football-shaped diamond, kind of shallow here, to get into areas that I couldn't get in with the straight handpiece, the straight diamond. You'd say that isn't too bad. That's staining for almost 20 years, 19 years, 1986 to 2000. Well, this is almost 2006. So it's almost 20 years. And we can put porcelain over the porcelain if we wish. But look at the change. Can you see the contrast from the left side to the right side? Yeah. And all we'd have to do is polish that. In this case, the patient wants a whiter shade, as many patients are wanting whiter shades now than what they had 10 years ago. Now I'm taking an ultrafine diamond and going through and polishing the surface of these teeth so they'll be smooth. Of course, we won't have to make any temporaries. Now we'll take the 30 fluted burr and go over her teeth and smooth them some more. So I got a picture of that. Open. Now what we're going to do is put a little bit of paint on dental dam on to reduce the amount of opportunity that the Ultrabond has for getting into the interproximal erasures. I like to use the light now to tack these in place. Close your eyes. Close your eyes. Are those 3 seconds?
Yeah.
Okay. Now let's have the mirror so we can show everybody what we did on the lingual side with the paint on dental dam. Okay, now we'll begin surface preparation. First step is to apply etch and seal. I like to use medium viscosity etch and seal. And I like to use etch and seal because it contains aluminum oxalate and it seals the dental tubules when you put that on. And then after I put a little dab on each tooth, I spread it around with the brush. And since it's medium viscosity, it doesn't run all over the patient's mouth. It's very simple to use. Now we're going to use tenure AB. And we put several coats of tenure AB on to get a nice glossy surface. And then we're going to try in the shade. Now, prior to the patient being seated, my dental assistant Jessica has treated the porcelain with porcelain conditioner and with Serenade Prime.
Right central.
Right central. My dental assistant always calls out the name of the tooth, not by number but by name. Okay. And then we gently push these to place. And which color is this?
Left central with B0.
B0?
Right central had B1.
And right central is B1. So now we'll give the patient a mirror so she can see which color she thinks she wants. They're very close. The right. Mm-hmm. She wants the right.
The right?
Mm-hmm. Now we take these off. It's left central, and this is the right central. Now this is not water soluble. The try-in paste is the same as Ultrabond Plus, only it's not activated. So my dental assistant will remove it. And I don't like to try all the teeth in first because they never look good on the try-in compared to what they're going to look like when they're finished. So I usually just let the patient select a shade, and then we put them on, because then they start looking at everything wrong. Now I'm using Tenure S to remove the extra Ultrabond try-in paste that might be on the teeth. And you say, well, what if you don't get it all off? Well, the tenure S will make the Ultrabond try-in paste polymerize just like the light will. So Jessica takes the excess out of the porcelain Lumineers. Vacuum up a little bit. Once we start surface preparation, try to keep everything dry, uncontaminated, and we want to work fast. And I start placing these. And the Ultrabond pretty much keeps them in position. We want to get these on fairly soon. I think she's going to like this. Left lateral. Then we go to the right lateral. Then we'll go to the right cuspid after the right lateral. We just gently place these in. Has the right viscosity to keep them from falling off.
Right cuspid.
Right cuspid. And I'm going to remove all the excess that comes off easily. But now we're going to go to the 2 millimeter 1 second tacking tip and tack these into place. I like the 2 millimeter tip because it will only polymerize the central portion of the Luminaire and allow me to remove some of the extra Ultrabond before it sets. And we have pretty much fixed the Luminaire in place, but we'll still be able to remove some of the excess. Close your eyes. What I've been doing at this time is removing all the excess Ultrabond on the lingual. Remember, we haven't removed any natural tooth structure, much less sensitive tooth structure. I want to make sure that I wipe off the Ultrabond from the gingival toward the incisal and make sure that all of the space between the porcelain and the tooth is filled with Ultrabond, because Ultrabond happens to be the restorative. Now we'll start going for the 5-second cure on each tooth. Close your eyes. Close your eyes. We take the 9 millimeter tip for 5 seconds on each tooth. Close your eyes. And close your eyes. Okay. Now we'll start looking at the lingual side here and make sure that we've polymerized it, because there's so much power in the sapphire light that you can generally get it all done just from the labial. Okay. Now I've taken a football-shaped diamond and I'm going across the lingual side, blending the porcelain, the Ultrabond, all together. And what I'm doing is taking all the excess and just blending it. Now we're going to take the Sure 349 and scale this off the labial surface. And I just get most of this off. Then we'll trim the margins. And the next step will be take a 12-fluted burr, high-speed water spray, and water is essential when you're putting diamonds and burrs on porcelain. Otherwise, it'll get too hot and you'll cause micro-cracking. And what's important here is to remove as much of the
Ultrabond from the interproximal and the gingival as possible. The reason I like to start out with a 12-fluted burr is it doesn't cut the porcelain. Now I come on the lingual side and I do the same thing that I did on the labial side, opening these embrasures. And I'm using 4-power magnification. That is essential. Wide. Real wide. And now we're going to go to the needle nose diamond. All these little devices and tools that I use are in one little package called the Lumineers finishing kit. So now we'll go back over the gingival margin and get rid of the shoulder. Now I know when I'm grinding on porcelain, whereas when we had all of the Ultrabond there, we couldn't tell the difference. So now with 4-power you can see the difference. And since we had diastemas to deal with, we want to be careful. Now we'll come back on the lingual side. Take the Shure 349 and remove some more. And it's a little difficult to discern the difference between Ultrabond and enamel because if I bite a moral, much of the moisture in her mouth will cause the Ultrabond to start separating. So the next step we'll do is check the occlusion. Reasons closed. Open. Well, this is pretty good. Better than I thought. So, can you see all the marks back there? Back to the bicuspids. Good. Okay. So, the next thing we'll do is open the contacts. I'll look and see if... I'll take the football-shaped diamond and I'll remove some of the eye spots there. Oops. What I'm doing is just getting some of the Ultrabond that marked a little high in there, going over those spots. Usually that's what the prematurities are in the beginning, although we really didn't have any prematurities. But wherever we're getting a little heavy on the blue, 98% of the time that's just a little extra Ultrabond. So now we just take the series saw and slice through the gingival embrasure, or the interproximal embrasure. Notice we have just about removed any trace of Ultrabond, because when dentists try to open the contact before they get rid of all the Ultrabond, they find it's quite a arduous procedure for them and the patient. Then what we don't get open on the placement visit, when we have the patient back for the second visit, we can do the refinement. And I see a little brown here that is beginning to distinguish itself from the porcelain, because when we got the moisture in there, it starts right away flaking it off. So if you don't have good surface preparation, it won't stay, and you don't want good surface preparation on a glazed surface. Open, close. Tomorrow we'll have Kristen back, and we'll do a little bit of minor adjusting, but we just about have 90% of what we want to get done. Open. And we want to check the lower teeth, and it doesn't look like any prematurities in there. Okay. And there we go, a brand new Lumineers smile.